Cialis or Viagra, Beatles or Stones, Coke or Pepsi, some debates never end. And when it comes to Cialis or Viagra, this is one of the biggest. But for me, there is no doubt which one I choose. It's, oh no, not so fast. We'll get to that. My name is Dr. Stefan Buntrock, board-certified urologist and specialist in sexual health. In this video, I'll tell you which ED drug is my personal favorite and why. And I won't stop there. We're also talking about Levitra and Stendra. And for the real superfans, I've got a bonus. Cialis and Viagra are very effective drugs, but did you know that these meds don't work for a huge number of men? Find out why. Want to know alternative treatment options? Then stick around. So let's get some myths out of the way. These ED meds, which are also known as PDE5 inhibitors, don't cause automatic erections, and they have no effect whatsoever on sexual desire. Disappointed? Don't be. You're avoiding embarrassing erections in public and court orders due to uncontrolled hypersexuality. That's no joke. There are drugs that can cause terrible hypersexuality. Dopamine agonists for the treatment of Parkinson's disease are known for that, and there was a trial in France about that. But that's a different video. PDE5 inhibitors block an enzyme called phosphodiesterase 5, which is responsible for breaking down erections. That's a very important function. Just imagine what would happen without PDE5. You would get an erection once in your life, and it would never go away. So PDE5 inhibitors help you to get and sustain an erection for making it harder for the body to break it down. This implies that you have to be sexually aroused for the drug to work, or it's night and you are sleeping. Then nighttime erections will be facilitated. Now, which one is doing a better job? Cialis or Viagra? And in case you didn't know that, their generic names are Tadalafil and Sildenafil. They are just as effective and they only cost a fraction. Sildenafil is the cheapest of all generics, at least here in Germany. In contrast to Tadalafil, it is short-acting, but you will still feel the effects for several hours. In Tadalafil, the effect may last for up to 2 days. I have seen these patients, but as a rule, most men will have 12 hours easy. If you're working as a porn star, 12 hours might matter. For everyone else, probably not. What matters is the timing of drug ingestion. In my opinion, Viagra Sildenafil has one important drawback. It interferes with food, more precisely with fat. If you take it before a fatty meal and plan for intimacy for dessert, this plan may not work out. You may not reach the drug levels needed for erections because your candlelight macaroni and cheese have neutralized your sildenafil. Cialis Tadalafil doesn't have that effect. In terms of duration until the drug actually works, there is no real difference between the two. Plan for 1 to 2 hours after you swallow the pill. Possible side effects are comparable, and this is true for all PDE5 inhibitors. Side effect means unwanted drug action. They don't happen in every user. Most men don't feel a thing, but some may encounter headaches, a stuffed nose, hot flushes, and reflux. Cialis has a special feature. In 3 out of 100 users, it causes lower back pain. This is not dangerous for your health, but painful. So in summary, both Viagra and Cialis are effective. Viagra is cheap, short-acting, and interferes with fatty meals, while Cialis is long-acting and largely unaffected by fat. My favorite? Tadalafil. The generic drug is equally effective as Cialis, and it is like the Swiss Army knife of PDE5 inhibitors. Because it is long-acting, it can be taken daily in small doses. For most men, this will be enough to be functional anytime throughout the day without having to take an extra pill. Tadalafil is also effective in acquired premature ejaculation, especially when it occurs alongside erectile dysfunction, and Tadalafil relieves lower urinary tract symptoms. Urine flow improves, urgency disappears, bathroom visits at night become rare. But here's the best part. PDE5 inhibitors are usually out-of-pocket expenses, at least in my country. But if they are used for prostate issues, the statutory healthcare system will pay for them. I don't know how it works in your country, so drop me a comment and let me know how it works in your part of the world. And while you're at it, hit the like button and subscribe to UroChannel. Even if some of you write very rude comments now and then, I still believe in the goodness of people. I know that most of you are polite and kind. So show some of this and give me digital applause for sharing my professional experience. It doesn't cost you any money and it makes me happy. Thank you very much. Now, let's talk a bit about Levitra and Stendra. These PDE5 inhibitors came to market after Viagra and Cialis were introduced. Levitra is vardenafil, and it is also available as a generic drug. It is short-acting and very similar to sildenafil, but it doesn't bind to fat as much so that it can be taken together with fatty meals. However, as a generic drug, it is the most expensive. I mostly prescribe it as an alternative if none of the other drugs is working. Listen up, this is an important key message. PDE5 inhibitors all have the same mode of action, but there may be individual differences in terms of efficacy. If one drug is not working for you, another one might. So it is always worth a try to switch drugs. Stendra is evanafil, and for the time being, it is not available as a generic. Stendra, Speedra, is the newest PDE5 inhibitor. It works faster than the others, sometimes in as little as 15 minutes, but it's actually shorter acting with a half-life of about 5 hours, similar to Viagra and Levitra. I almost never prescribe it because of the costs involved. There are effective choices that cost a fraction. Alright, so we've covered the best options, but what if none of them work for you? It happens. In fact, 30 to 35% of men don't respond to PDE5 inhibitors. But before you give up, I have one golden piece of advice that might make them work for you after all. This is what you can try if it happens to you. Some men are so afraid of side effects that they just don't take enough. The drug is not working because the dose was too low. Always start with the maximum dose to get a feel for the effects. If it is working, then you may play around with reduced dosages. Some men are too impatient. They don't wait long enough after taking the drug, so it hasn't started to work yet. Some men think erections happen automatically, but I have already debunked that myth. By following these simple steps, a few of the non-responders can be turned to responders. If there are still no effects, these are the possible explanations. Diabetics have less effect of PDE5 inhibitors in general. This is why managing diabetes is key to prevent further damage to the body's vital functions. Severe cardiovascular disease is likewise linked to malfunction of the drug. Also, structural penile issues may prevent drug action. I am talking about nerve damage due to radical prostatectomy or radiation to the small pelvis or penile corporal fibrosis. If your erectile dysfunction has a psychological nature, then PDE5 inhibitors may not work as well. Or it could be the drugs that you use otherwise. Beta blockers for hypertension would be a good example. I think with all the information I have just given you, you begin to understand how important it is to have the correct diagnosis of the underlying cause of the erectile dysfunction. I always start out with PDE5 inhibitors to see if there is an effect. But this is also for diagnostic purposes. I want to know whether someone is a responder. So, what are your bailout options? Vacuum pumps are an effective choice, even though many men in my office don't like the thought of pumping. Injection therapy is very effective if used correctly, and last but not least, a penile prosthesis may be worth considering if nothing else works. I have uploaded videos on these therapies, just have a look at my channel homepage on YouTube. Personally, I'm specialized in regenerative therapies including shock waves, the P-shot and EMTT. But even here, the same principles apply. It's the right treatment for the right patient at the right time. Curious if regenerative therapies could work for you? I break it all down in this video. Click here to watch it now. And here's one last thing you need to know. Are PDE5 inhibitors safe for your heart? Don't miss this one. It could be important for you. This video will provide you with the answers. Thanks for watching. Bye bye.